Ashley Toski, and welcome everyone to the COVID-19 update for Mendocino County. Today, of course, we will hear an update from our County Health Officer, Dr. Andy Corin. This will be followed by a Q&A with local media, and if time allows, I will announce questions from the public for answering at the end. If you have a question you would like to ask, please leave it in a comment on this video, and we will try to get as many of them as possible. Now let's give our attention to County Health Officer, Dr. Andy Corin.
Hello, everybody. We'll start with presenting the data, the numbers today. The total cases in Mendocino as of yesterday, November 19th, was 1,368. Of that, 822 or 61.5% were from the Latinx community. On November 19th alone, we found 30 new cases. 18 were Latinx, 1 Native American. The doubling time now for our community is felt to be 6 days. There's a number of ways to calculate that, but this is our best guess at this point. And quarantine is 186, isolation is 106. Hospitalized as of last night were 9 people, none of whom were from the Latin community. There were none in the ICU. We have hospitalized in Mendocino County, from Mendocino County, 5, and 2 are from outside of Mendocino County. 3 are outside of Mendocino County in rehabilitation centers. And the total number of deaths in our community from COVID is 22. Our case rate is 8 per day. That is a 7-day average with a 7-day lag. It is 47% higher than just 2 weeks ago. And earlier in the week, because we're a small county and relatively small numbers make big differences, earlier in the week, the number was 3 times higher than 2 weeks ago. So we are now in the purple tier, along with 41 other counties who turned purple this week. And nearly all of the counties in California have turned back 1 or 2 tiers. The governor applied what he called an emergency brake. So tiers changed back immediately and only using 4 days average worth of data. There is no implementation lag time. Just to review, purple tier for us means outdoor only for places of worship, for restaurants, gyms, personal care, though nail and hair can still be attended to indoors. Indoor retail has been cut down to 25% capacity. Schools that did open during the brief time we were in the red tier and the ones that have been open, mostly waivered K through 6 and childcare, they stay open. Small groups for children who needed IEPs, language assistant, IT assistance, and so forth continue. Others continue distant learning. So this is because we are in a huge surge, and this surge appears to just beginning. It's important to understand US deaths so far from COVID over 10 months is 250,000 people. Remember that over 70 years, we haven't lost that many people. In fact, that's 2.5 times more than the total of American lives lost in all of the wars back to World War II. That's just to put it in perspective. Nationally, we're breaking records every day. Consistently, we're exceeding 150,000 new cases nearly every day for the last week. That is a 250% increase over 3 weeks. In California, where we've done well compared to the rest of the nation, we now see over 10,000 new cases a day using a 7-day average. The hospitalization rate is 63% in our state. ICU utilization is up 40.5% over the last 14 days. It is this acceleration of the pandemic that has us all worried in the health fields. It is accelerating at a rate that is 2.5 times faster than the rise we saw in the surges in June, July, and the numbers are much bigger now. In California, the numbers are mostly driven by Los Angeles, which has had a case rate of 147% increase over the last 2 weeks. In Madera County, a smaller county, more like ours in rural Central California, they saw a 467% increase over 2 weeks. At this rate, Mendocino County could run out of intensive care unit beds in 2 weeks. We've gotten transfers already from counties south of us who themselves have run out of hospital beds. This is mostly related to the lack of healthcare workers who also get sick. We now know that we're seeing 12% of new cases wind up in the hospital 2 to 3 weeks later. Why is this? Well, we know that it's cold, wet weather that drives people indoors where germs can leap from one person to another easily. But this germ especially likes cold weather and survives longer on cold surfaces and also in its suspended state in aerosols. This is a season of holidays. We've had Halloween and Veterans Day and sporting events. All of those are opportunities for people to gather and germs to spread. And upcoming are still Thanksgiving, Christmas, all those holidays, plus New Year's. There's going to be more spread. Because of this, on November 19th, the California Secretary of Health announced new targeted response for purple tier counties called the Limited Temporary Stay-at-Home Order. And this means we're to be staying at home from 10 p.m. until 5 a.m. At those times, you can only go out to get food, groceries, or takeout, medications, or walk the dog. Only essential services are able to be open. This puts relatively small limits on most of us, but it does limit spread in those key hours where gatherings are more associated with uses of substances and loss of some inhibitions and people spreading the germs more easily. This temporary stay-at-home order will be from November 21st to December 21st, and then it'll be reevaluated. More changes may be needed. Many people have asked questions about outbreaks. We had an outbreak in Juvenile Hall, which has been mitigated, and it was relatively small. We have a outbreak in Redwood Cove Skilled Nursing Facility that has been very quickly contained with very few cases. This past week, we had an outbreak at Noyo Harbor Inn. Again, very few cases. The place was closed and cleaned very thoroughly, and they are working with public health, having an outbreak testing session on Saturday. These outbreaks are quickly controlled because of the diligence and the exemplary cooperation of business managers. Today, there was another case that was reported, another outbreak that was reported in a board and care facility. And again, outbreak testing is going forward. We have a great team to do that outbreak testing. And when they call, please be forthright with them and give them your information. If you have questions about businesses or a citizen, call the call center at 472-2759. But outbreaks are not responsible for the vast majority of cases. There's no specific industry that we have identified. The majority continue to be community spread and close contacts. Many are home clusters, more than 3 people, but they're in the same home. Analysis of our data over the past month shows that more than 50% of new cases were spread in the home. And it has to do with failure to quarantine correctly often. So what is quarantine? We found out so many within the household get the illness while they think they're in quarantine that we're going to take a few minutes to describe this more thoroughly. And Becky Emery, who is our Director of Social Services in Mendocino, is going to present that. Becky?
Good afternoon. Quarantine has been defined as closer than 6 feet for up to 15 minutes in a 24-hour period. This is different than previously, as it is in 15 minutes rather than 10, but the 15 minutes are not required to be continuous. So it could be 3 interactions of 5 minutes in a day. Individuals in quarantine should be separating entirely from anyone in isolation. but also should, whenever possible, be separating entirely from other people that are in quarantine in their household. If their household doesn't allow for those separations, we encourage people to use our alternate care site to help support keeping your family safe. We do recognize that there are some situations where people can't separate from their parents, such as, a parent and a child. In these situations, individuals in quarantine that are not able to fully quarantine separately need to wear a mask and maintain that social distancing of 6 feet as much as possible from one another. Families should also clean all of their flat surfaces and restrooms in between each use and use, whenever possible, disposable utensils and plates. The goal is not only to prevent the spread from person in isolation, but also to limit the spread from individuals in quarantine that may not have yet tested positive. And at the end of their quarantine, it's recommended that individuals get a COVID-19 test. We do want to make sure that people that are getting that test are those that are being released from quarantine. We're not recommending this test for individuals that are released from isolation.
Thank you, Becky. So I want to go on to testing services that have been a very big concern in our county over the last month. It's improving now. The new OptumServe program will continue at the fairgrounds, and as of, I think it's November 27th, it will be open 7 days a week. So that's a good thing. We also have other contracts that will be beginning after Thanksgiving to take the testing throughout the county. Please get tested. And if you're positive, isolate. We encourage you to list during that time and call your contacts and tell them to quarantine. The instructions are actually on our website. Also, our Mendocino County Contact Investigation and Contact Tracing team has been instrumental in rapidly controlling outbreaks before major spread has occurred. When they call you for a positive test result, please tell them about all of your contacts, as it helps your friends and family and the entire community. This is a confidential process. None of the people who will be contacted will even be told who the original case was. No other agencies will be told about who has called them or who we've contacted. They will help you also to figure out how to best protect your loved ones. If you've been in contact with someone with COVID closer than 6 feet for 15 minutes cumulatively over 24 hours, or if you have symptoms, you're coming down with something, don't go to OptumServe. That is only for screening. Call your clinic or your doctor or your provider who can order a different test in a way that won't threaten the other healthcare workers. And it's really a different kind of a test. Remember the non-pharmacological ways to protect yourself and your family. Mask all of the time except when eating. If alone outside, take a break, but mostly keep the mask on all the time. Distance is very important for large droplets to fall, but especially in the cold weather, there's still small aerosols that are suspended outside. Wash and sanitize your hands and the surfaces you're around. And to get rid of those hanging aerosols, ventilate all rooms and cars. Keep the windows open. And this is key. We're doing this to protect ourselves and our family and friends, and also the hospitals and healthcare workers and intensive care units, so they can help us or our friends and family when they are in need. New research also shows that masks are now found to protect the person wearing it, in addition to those around him or her. We do have phone numbers, remember, for people who feel down or depressed. Call the Warm Line, which is open from Monday to Saturday, 7 to 6, 472-3111. And for questions about health orders, or if there is a delay in lab results, use the call center, which is open 8:30 in the morning to 5 p.m., Monday through Friday, and that is 472-2759. We've changed some orders lately. As Becky mentioned, the gatherings are now reduced to a maximum of 12 people. It should not include any more than 3 household units. So that's one change that we've made. Another change has been hospital reporting, which is to better help us predict and work together to address shortages when they occur. Another good thing that's happening is that we have now been able to fund the model called Promotores de Salud for community outreach by and for Latinx people. That should be rolling out in Willits starting on November 17th, which is already passed. Guidance we have on our website is the CDC guidance for safe Thanksgiving. And I know all of us have already been through a lot. We've learned new habits, canceled or postponed seeing friends and loved ones. We've missed milestone celebrations, suffered closures, loss of jobs, bankruptcy, loss of housing. We're tired, we're frustrated, we're annoyed, we're angry at all the restrictions. But a better day is coming. There are safe vaccines that are on the way. We must bear with this now a while longer, and these days before us are going to be a severe challenge. So here's a summary of my new advisory for holidays and travel. Avoid gatherings of anyone outside your household. I know I said 3 households and I know I said 12 people, but it is better to avoid them entirely. Use a telephone or teleconferencing. You've gotten familiar now with Zoom to share. Don't travel. The new advice from the CDC is simply don't travel. If you're sick or you have been in contact with a COVID patient in the last 14 days, if you are elderly, have chronic conditions like obesity, heart or lung disease, diabetes, cancer, or other illnesses, or take any medicines that might affect your immunity, stay home. This is the most painful. I know it. My mother-in-law just turned 91, and her grandchildren have been asked to skip this year. So they're going to stay in Santa Rosa and in San Francisco, and it's heartbreaking, and I'm sure it is for you. So other information, don't forget the influenza vaccine. We're having a drive-through clinic from 8 to 12 tomorrow at the Department of Public Health. It is free. Donations will be asked for, but if you can't afford them, then it's free. Wear a mask all the time when indoors, unless you're alone or with members of your household group, except when eating, obviously. Maintain your 6 feet of distance. Wash your hands for 20 seconds and use the sanitizer in between if you must. Increase airflow, such as being outside and increasing ventilation, inside with open windows or with adjustments to your HVAC systems. If you gather, keep it to 1 household group, no more than 3, and less than 12 people, as I said before. These should be outside, especially if you're eating, and last 2 hours or less. Keep a sign-in list for 2 to 4 weeks in case someone does become sick and the contact investigators call. It'll help with tracking down who might have been exposed. Plan for the gatherings and traveling the week before by avoiding other gatherings outside of your family unit. Consider getting tested, but remember that one test does not tell us that you're without COVID except for that point in time. So again, stay away from people outside your household unit. Avoid physical contact with those outside your household. Wave instead of shaking hands or hugging or kissing. If you're going to be eating or drinking, remove your masks at that time and don't risk more transmission. Avoid shouting and singing loudly, chanting, or playing wind instruments. These increase transmission and contagion. Avoid sharing phones and toys and utensils. Bring wipes to disinfect objects that were shared, and do this when you return home. Traveling, again, I said don't travel, but some will have to travel. Avoid non-essential travel outside of the county of Mendocino. And upon return, it is a best practice to quarantine for 7 to 14 days. Consult the California Department of Public Health website for travel outside of the county, and the WHO website for travel to other countries. And I'll say one last thing, avoid Black Friday shopping. People are clustering and there's a huge amount of transmission that happens during those events. And actually, that's where I'll stop.
Thank you so much, Dr. Korn, for your update. Now we will be entering the media Q&A portion of our update. And first up, we have Sarah Reith. Sarah, whenever you're ready.
All right, thank you. Can you hear me?
Yes.
Thanks. I'd like to go back to the testing plans. I'm wondering what the status of the application for the mobile testing unit through OptumServe is, and if there's more opportunities for the clinics to do surveillance testing through an arrangement other than the one that expired with UCSF.
Good question. So as I said, the the OptumServe testing program is alive and well at the fairgrounds, and in fact, it's going to be expanded from 5 days a week to 7 days a week. We're very happy about that. We have also found that we'll be having the ability to travel around the county at other sites. That hasn't been set up yet, and the mechanics of that are in the works, but it should be happening over the next week or a couple of weeks. And there may be other things along the way, but we are still in negotiations with the OptumServe and that organization. So we're looking into that, and these are all important questions and important services that we want to make available for free for the county.
And so this other OptumServe option would not be a van, it would be more like a pop-up, or what is that looking like?
Becky, do you want to take that?
I'd be happy to. So Sarah, what it is it is a mobile site and not a van. It does require a brick and mortar site, but is it a temporary, so it can move around the county to different places. It will do up to 165 tests in one day. And we are approved to utilize that resource up to 5 days per week. And it is approved to start rolling out December 2nd. So we are working on that scheduling and working on making sure that we have that resource working in a manner that it will cover the entire county as we're working through the schedule for those sources.
Okay, thanks. And my second question is about the curfew. Of course, we're all supposed to stay in between 10 p.m. and 5 a.m. And today the sheriff announced that he would not be enforcing the curfew. And I'm wondering if code enforcement or public health has a policy about making sure that people stay inside during those hours.
I don't have any plans for our enforcement personnel to go around and enforce between 10 and 5 a.m. This is for the public to know and enforce themselves. We have lost many wars worth of people. This is no joke. If this was a war, we'd be in our basements, sheltering in place from bombs. So we hope that the population will understand this, grasp it, and police themselves. There shouldn't be a need for enforcement. And so that's my response to that.
So is there going to be a messaging campaign like the Mask Up Mendocino to really bring home that message to people?
Well, this is part of it, and you can spread it more.
All right, thank you.
Thank you so much, Sarah. Next, we have Adrian from Mendo Voice. Adrian, whenever you're ready.
Hi, everyone. Thanks for having me. I did want to actually follow up on Sarah's last question and directed at, I'm guessing Becky would probably be better able to answer this, is could you describe I know it's a little complicated, could you describe exactly which department does which enforcement, has the authority to do what kind of enforcement? So what kind of enforcement actions does the sheriff have? My understanding is that's masking primarily, and what kind of enforcement actions, what Chief Martyr's department, what kind of enforcement actions are they doing with restaurants and stuff? And can you talk a little bit about that division of labor?
Sure. Thank you, Adrian. So yes, Chief Martyr has been working in collaboration with the Sheriff's Department. They do the enforcement for masking in restaurants and in businesses and in our community even. As far as those masking efforts, there's been a lot of education that they have done. There's been some places that they've had to do further investigations and discussions, and even some citation.
I'm sorry, Becky. You said they're doing that, but you didn't specify who they was. Are you saying the sheriff or Chief Martyr's department, or both?
I'm saying that both work simultaneously for that effort. Sorry. And it depends on who's available at that moment and who's responding in which different ways. Certainly they both respond to those efforts. So, and when I say they, I mean both the sheriffs, also our local police departments. As to code enforcement is really working in the businesses to make sure that they are following those requirements as a business and following the codes that have been put forward, and also the guidance from the health officer.
So if let's say there's a restaurant or a bar that's operating past 10 p.m., is that a situation where building code enforcement comes in, where Health and Human Services and John Martyr's department comes in, or where the sheriff comes in? I just want to be very clear about how that separation of powers works.
We have a call center that we would hope that citizens would call in that kind of a problem. But keep in mind that restaurants are actually encouraged not to be open for people coming in and eating sit-down meals, but for takeout. This is a difficult time for our community, and it is for the restaurants as well. So, I don't want people to mistake someone going to the door of a restaurant to get takeout from breaking the law and going to eat in a restaurant. That's one thing. But we do have a program in our county, and we have been using it in the last month, to have the people who usually do evaluations of, for example, eating establishments, to evaluate their compliance with, food safety. And they are now going around and looking at how they're implementing their own attestations for keeping their businesses safe. These are mostly educational. Most of the businesses, the vast majority of the businesses in town have been very cooperative. They look for us, they look for help when there is a problem in their businesses. They have been very open to making whatever changes and adjustments that are necessary. In fact, the businesses in the Chamber of Commerce have, from the beginning, began the Mask Up Mendocino campaign, where they're giving out masks and doing advertising. And now they're beginning to organize testing on site for their employees. So, but that's a long way around your question. I realize that, but I hope that gave you useful information.
No, that's very useful information, and I'm not trying to discourage people from taking takeout from restaurants. What I'm trying to get to the core of is a jurisdictional question. Is to say, is this something that Martyr's department and the sheriff's department share jointly, or are they tackling different aspects of this? Because it gets to my next question, which is the sheriff's statement that his department is not going to, in fact, enforce the curfew. I'm wondering if that's a decision that the sheriff made on his own in his capacity as an elected sheriff, or if that's a decision made in consultation with you, or if in fact that's a decision that you have made and directed the sheriff to follow.
It's not a decision that was made in consultation with me.
So that's strictly Kendall's decision that he's making there.
Yeah. I also think that at this point, 99% of enforcement is education. What I was saying is that Sheriff Kendall did not consult with us about doing it, but he has.
I'm still here.
Thanks, Adrian.
I just got back. Did you hear anything of what I said?
No, you disappeared again. Sorry.
Okay, well, hang on to your seats and I'll try and be quick. No, the sheriff did not consult with us. Did you hear that? Okay.
Yes.
2, he's doing lots of stuff as well as the other police departments when there are, more violent or dangerous kinds of crimes being committed. I do think that, the gatherings are extremely dangerous for our community. Most of the time, addressing them is simply educating people of what they're doing wrong, why they're doing it wrong, and in the worst cases, they may be cited. And I wouldn't be surprised if a sheriff drove by a big gathering on the corner and found it, that they wouldn't say something to educate them. But I don't think that they're necessarily going to jump out of their cars and make a bunch of arrests. That wouldn't be good for the community.
So if the sheriff is not enforcing the curfew, is it the case that John Martyr's department, which is subsidiary to Health and Human Services in the county, and thus, if I understand it correctly, under your supervision or under your direction, if not supervision, are they going to be enforcing the curfew? Because they do have a different jurisdiction and authority.
So they receive and review calls in the call center. And the enforcement there has been usually talking to people. It's been educational, and there have been 1 or 2 citations. Again, I'm going to emphasize, this is citizen enforcement. We know what protects ourselves, and we want that to happen.
Mm-hmm. Okay, so just to be clear, neither law enforcement organization will be actively enforcing the quarantine, the 10 p.m. to 5 a.m. curfew.
Well, I wouldn't say that. I think, again, there's the call center is available, and we'll have to see as time goes on what the consequences of utilizing really community enforcement.
The call center, I think, only goes till 5 p.m., so it wouldn't be available during the curfew hours.
No, I think that there is a rollover to another on-call service.
Okay. Thank you.
Thank you so much, Adrian. Next, we have Danila Sands. Danila, whenever you're ready.
Thank you. I had a question about enforcement too, but it seems like they really got the answers on that one, so thank you. One question I had, if Dr. Corrin could elaborate, he talked about ICUs and the concern about them being full, but he also described that we have some people here from out of county. Does that mean they tested positive and the numbers are from another county and they're staying here? And then you said that some are staying out of county. Can you explain why some people are not housed here and why we may become full here, and kind of explain a little bit more about that?
So we have several people who have been discharged to nursing homes in another county. And that's because our nursing homes did not have room for them. Okay. And room doesn't necessarily mean full rooms. It also is an issue of staffing. It's very high intensity to take care of nursing home patients, hospitalized patients, and ICU patients, especially when you're putting on and taking off personal protective equipment all the time. So the reason for people being in nursing homes out of our county is because we didn't have the beds for them. The reason for people who may be hospitalized in our county is because in those counties, there weren't beds for them, and we had them at the time. So we're all trying to cooperate together. It's not that we're giving up beds, we're giving up some beds that we have to people who also need medical care. And then when, when it comes our turn, those counties will reciprocate. We'll do what we can. I mean, this is the horrible future of what we want to avoid in a pandemic, is all the hospitals, all the ICUs, the nursing homes are filled up. And that's why there are these quarantine orders and all the other distasteful things that we have to do to protect our community, and very directly to protect our hospitals and healthcare workers.
Okay. And just to add on to that, we still have the ability to put up pop-up tents. I mean, is that something in the background?
Oh,
If
do
the
you mean
ICU fill up, the things we all did in the beginning.
there is a capacity for reserves? Yes, there is. But
Okay.
those reserves get used up also. We're talking about huge numbers that could be, that are happening in other places that so far we haven't seen in Mendocino. We see a trajectory that's going up, and it's going up very rapidly. And again, if we think that 12% of those cases are going to wind up in our hospital in the next 3 weeks, and we see a doubling time of 6, 7, 8 days, we could be full. And what do you do then? And that's not just for COVID patients. Someone gets in an accident, someone has a heart attack. We literally will not have the room in our community or other communities in California for putting people, for taking care of people in our hospitals. That's one of the big focuses of why we're doing what we're doing.
Okay, thank you. And then my last question, I keep getting asked this. In the beginning, the other health officer had talked about the possibility of false negatives, was like a 20% number, right? And with all, I don't know if that's still true. That was towards the beginning. But now going forward with all the tests that we have done, and you've talked about people with symptoms should not go to Optum Serve, right? That there's different tests out there for different things like surveillance and direct exposure, et cetera. Are we seeing any false positives? And if we are, what is the reason for that? Because we keep getting that asked.
So the answer is no, nothing is perfect. And the same thing is true with the highest tech, highest everything that you can imagine. So these tests have been rolled out, and there are variants, there are differences between the tests. And we talk about sensitivity and specificity. And we have a better reliability when the sensitivity is good and when the specificity is good. So sensitivity is, if you've got a little something, then our test will darn well pick it up. Even if it's a small load of viruses, we'll pick it up. That's sensitivity. Specificity is, if the test says you're positive, then you probably have the problem. Or if it says you're negative, there's a negative predictive value, and that says that you may not have the illness. But in either of those cases, they're probables. So you're always going to have some positive, false positives and some false negatives. So we select the type of test to use based on the sensitivity and the specificity, and it changes in the situation. That's why we have a very sensitive test called Binax now in our community that's being distributed by the feds through the state. It's very sensitive, but we want to use it only in those people in the conditions where they've been symptomatic for the last 7 days. Because under those circumstances where there's a higher predictive value, they're in a situation where they have symptoms, they more probably have the illness. Then if they have the positive test result, it's a more reliable result. If you use those same kind of tests for people who were asymptomatic, there would be a lot more false positives. So the people who set these up have given a lot of thought to it. And, COVID is 10 months old. And so our experience with it is not like it will be in another year or two. And hopefully we'll put this aside in a year or two. But this is a developing science. I hope I'm answering the question as best I can.
Yes, you have. Thank you.
Okay.
Thank you so much, Danila. We do have one more media outlet that has pre-submitted 2 questions. This is from Matt Lefevre. The first question asks, what can you tell Mendocino County residents about the efforts the county is making to store up the necessary supplies and infrastructure to receive, store, and inoculate our population with the vaccine?
Well, the supplies that we have had, like the personal protective equipment, is an ongoing effort by our medical health MOOC, Medical Health Operations Center, or something like that. I hate to forget the names of the initials, but they take care of that. They are also taking care of obtaining and will be distributing a lot of the vaccinations. The important thing right now is that there are many different modalities and ways that we're going to be distributing the vaccine. So, for example, the two pharmacies, national pharmacies, CVS and Walgreens, has stepped up. I mean, they've been given good contracts, I'm sure, to be able to inoculate people in our skilled nursing facilities who are the most vulnerable. So we've made sure that our county nursing homes and long-term care facilities are signed up to receive that. That's one of the efforts that we've made. We also have a mass vaccination program because the logistics of distributing this to the thousands of people in our county are very, very difficult. So we're using our old mass vaccination program and looking that through carefully, considering the characteristics of the new vaccines. So I'm sure you're aware, or many are aware, that one of the new vaccines will require for storage a temperature of between 70 and 90 below 0 Celsius. That's a very, very cold, that's like as cold as dry ice is. And every time you open the refrigerator for that, you're dropping the temperature and you're risking the viability of that vaccine. So, and in addition, the plan at the manufacturer side for distributing that particular vaccine is to have that to go out in lots of almost 1,000. So that is going to be very, very problematic for a county like ours that's so spread out and without huge population zones can do it. So we're looking into how to do that and collaborating with the hospitals around that, because healthcare workers will be among the first who will get those distributions. But then what about the people around the rest of the county? We're looking at that. We're looking at it with the state health department, scratching our heads, who's going to get what and when. And there are other vaccines that are becoming available. So I was just talking about the Pfizer vaccine that requires the ultra cold freezers, which we in the county don't have any. So we're going to have to be in line to buy or share them with another county. And we're working at this point to work those issues out. But there are other vaccines that are coming down the line that can be stored and distributed more like, for example, a measles vaccine in a minus 20 degree environment. And that would be much more capable. So I don't know which way it's going to go, but I can say we're starting to have weekly meetings with the hospital and with and it may be actually increased soon because these vaccines are coming online rapidly. My head is spinning at how fast they're doing this, but it hasn't been approved yet. Nothing's been approved. So the state has developed its own task force with 4 separate work groups. One to retest the safety and the efficacy of whatever vaccines come down the pipe. Just because we want to make sure that people have confidence in these vaccines. I mean, there's some people who just feel like all vaccines are, terrible, but many people are concerned about this vaccine, and some for good reason. There's new technology. The Department of Health in California is utilizing some of the most experienced minds, brilliant minds from Universities of California in San Francisco, UCLA, Stanford, and so on and so forth, to make sure that it's safe and it's effective and assess how effective and how safe it is. And then they have another work group that's looking at how it'll be distributed and how it can be distributed with equity running throughout all of these programs. And then messaging. We want to make sure that people really understand. When I say it's new and different, what does that really mean? What does the risk really mean? What data do we have to say that this is effective? And if there are some risks, what are they? I think people need to know that. So California also thinks people need to know that. And they're working very hard on figuring out how to do all this. And we are in lockstep with them, doing our part. I hope
Thank
that
you,
answers.
Dr. Corin.
Okay.
Matt Lefever's second question asks, what kinds of stories does contact tracing tell here locally? Are we seeing patterns of transmission such as one age group to another? Are specific locations or types of businesses more prone to transmission than others? What about gyms, grocery stores, restaurants, or is the overwhelming site of transmission in private homes?
So there's much data not generated from this county about, for example, restaurants and gyms and so forth. Healthcare workers who are frontline or exposed, of course, they're going to have more than the general public. But in general, we've actually done some research locally on what are the things that are spreading it here. And it is not a specific industry. It's not any mix of businesses. It is actually in the homes. More than 50% of contagion is coming from individual homes. So a person may or may not know that they have COVID. And if they don't know, of course, they're going to spread it to people in their household unit, even if they're doing everything we tell them to do it, unless they're really quarantining. And why would they quarantine if they don't think they have it? But also many people, I don't know if I've lost you. Let me just sign on here for a second again. Oh, that went smoothly. So, but the other thing is many people have the illness and can pass it, and they're not symptomatic. And so it's very important that people follow the instructions that we've given them for just your general care. But then someone gets the illness in their own home, and we call them right up to investigate how are they doing, who else have they contacted, how are they planning to isolate themselves in their home. And then, as Becky said before, we have to teach, how do you really isolate? How do you really quarantine? There's an idea that if, mom has it, then dad and the 4 kids can be quarantined together. Well, no, because one of those kids might have it and carry it to dad and the other 2 kids. So all of them have to try and quarantine separately. And these are things we have to teach them. That's why we have a really wonderful contact investigation, contact tracing that I've heard from other health officers. They can't keep up with the number of positive cases. And we're contacting people on average in a day or 2. And then beyond that, the contacts in a day or 2. And I was on a conference call with the folks in San Francisco who are doing a great job. They have tremendous resources. And they were amazed that we're doing as well as we are. And every time we do that, we really control the infection in our community. But as to where the infection is coming from, it's going from person to person in our homes. That's a predominant multiplier.
Okay, thank you, Dr. Corin. We do have a little bit of time to address some questions from the public on social media. So the first question from the public for answering is, can you explain why we should get tested for COVID-19? Is wearing a facial covering, social distancing, and avoiding gatherings enough to ensure we don't have the virus?
The quick answer to that is no. You can't ensure it. This stuff hangs out in the air, and it can get beyond the mask into the eyes and so on and so forth. I'm not saying that those are huge effects, but when you're dealing with tens of thousands of people, there can be. And nobody is perfect. Even like I was coming in here to the health department the other day, and I got halfway to the door and I said, whoa, I don't have my mask on. And I went back to the car and put it on. We all make those mistakes. And so we've got to try. Some of those mistakes don't amount to anything. Some of those mistakes amount to a transmission. And so the testing tells us who has it, who doesn't even know they have it. That's why it's important. And if we can catch a person there, each person transmits, as far as we know, each person can transmit. In some cases, it's more than this, can transmit to 2 other people. If you do the math, then each of those people transmitted to 2 people. And after 10 cycles of transmission, it's 1,000 people. So if we arrest that with finding out someone has it, we're knocking out dozens and dozens of cases. If we investigate and find the person who has it and we prevent them from passing it to another 2 people, we've prevented a huge number of infections. So that's the reason for testing and contact investigation, contact tracing, which are very, very fundamental technologies in fighting this infection.
Thank you so much, Dr. Corin, for your update. Unfortunately, that is all the time that we have today. The next update is slotted for December 4th, and we hope everyone has a wonderful day. Thank you so much.
Thank you.